All right.
Hello,
It looks like
we are live.
we are live. I'm just going to try to figure out how to share it on my screen.
Hello,
Oh,
everyone, and welcome to our show. The doctor is in.
okay. Let me see if I can't get to share this.
I'm Ricky Fairley, and this is Dr. Monique Gary, and we are so awesome, so happy that you have joined us to talk about breast cancer during the COVID-19 era.
Hi, everybody. Sorry for the delay. We had a little bit of technical difficulties. I am trying to share this on my Facebook page. Ricky, you can certainly share it on your Facebook
Yes,
page. But we do want to welcome everybody to the really the second, but really the first pilot with blackdoctor.org of The Doctor is In. I'm Dr. Monique Gary. I'm here with Ricky Fairley. She is the Vice President of Strategy for Sisters Network. And we want to reach women across the country, our sisters in particular who are battling breast cancer. So our survivors, our previvors, our metavivors, and their caregivers, the people who
our
know
warriors, our
our
war
warriors, the people who know them, the people who love them. And we want to try to connect
survivors.
you all to each other and to relatable and reliable resources for breast cancer. So here we are, and we're so thankful to blackdoctor.org for sponsoring this time with us today. And so the doctor's in, and we are going to be speaking with a patient and a friend of mine in a little bit, but we thought we would honor National Minority Cancer Awareness Week. It is National Minority Cancer Awareness Week. And although we're in the midst of a pandemic, we cannot de-emphasize the need for us to recognize this health disparity and for us to begin to strategize to do something about it. So today's talk is really to put a face to this disease and to share some stories with you. And we hope to get your feedback, your engagement. We want you to write in with your questions. We want you to watch, share it, watch and watch again. So thank you so much for joining us. And Ricky, I thought we would start off with a little bit of data. So I'm going to try to share my screen. And this
Sure.
platform is new to all of us. So hopefully you can see it as well. How about that? Can you see it, Ricky?
Not yet. Try again, maybe. There we go.
Here it is. All right. So we know that breast cancer is a fatal health issue for African American women. I think all of us know someone who has the disease, someone who has been battling it. We know that we're at increased risk for it. And what you may or may not know is that it is a unique and a different disease. When it hits us, it hits differently. There's that saying that, when America gets a cold, you know, Black folks get pneumonia.
Yeah.
When we get breast cancer, we get breast cancer, and it affects us so differently, and all of the reasons why are still not yet known. But we have a 31% mortality rate, which is the highest of any group in the United States. We are 42% more likely to die of our disease. And these are numbers that are just staggering. Wouldn't you agree, Ricky?
Devastating, devastating. 42% higher than white women. And it really makes us different and special. We need to handle it differently. Yeah.
Absolutely. And under the age of 35, Black women get breast cancer twice the rate of white women and die at 3 times the rate. And so, this is something that when we talk about believing Black women, this is a really important topic because I think we have seen more than ever with the COVID-19 pandemic that the health disparities exist and persist, not just because of individual responsibility, but because of systems issues, because of access to care, because of implicit bias in medicine. And these are things that we need to address because young women are diagnosed with more aggressive disease. We are more likely to be diagnosed at a later stage. We are dismissed more times, and our insurance doesn't always cover scans for young women, although we are disproportionately affected. I'm sure you've seen this in Sisters Network, right, Ricky?
Yeah, we hear a lot often where a young woman would go to the doctor with a lump and say, I have a lump, and the doctor will say, you're too young to have breast cancer. Come back in 6 months. 6 months later, they're metastatic. So we're getting it in late stages. And a lot of it too, Monique, is that we're not checking ourselves. We're not checking our bodies. We don't know our history. I call it, we don't know our her story. And we don't know how to check ourselves and know the importance of early detection. Because we can't prevent breast cancer, we can only early detect it. And that's, we don't know our bodies. And it's funny because we do know our bodies most of the time, but we're not taking that time to really check our breasts on a monthly basis. And that's really, it's killing us.
I'm going to also add to that. And I think that, people don't know what a normal breast feels like. And when I talk to patients in my office, I spend a lot of time educating them on what the different types of lumps are. What is fibrocystic breast? What do dense breasts mean? And how does that feel? So that when you go home and you do your breast exam, you can identify with, okay, this is what the doctor told me. Here's how this lump feels. This is what my normal breast should feel like. And so I think that, we shoulder some responsibility in the medical community for not really educating patients about what they should feel and how a normal breast feels. But yes, there's a couple things that we don't necessarily like to talk about. And I look forward to the day when this changes. But I say, Black folks don't talk about money. We don't talk about our health. Those are things that we keep secret. And those secrets are things that are killing us.
Right. Well, I'm an 8-year survivor, and my doctor found my lump on an annual checkup, and it was a little peanut, the size, almost it felt like a peanut under my nipple. And had I been paying attention to my body, I should have found it. And when she showed it to me, I was like, wow, how could I have not felt that before? So I wasn't checking myself. And, I was lucky that she found it. And she said, it was so aggressive that had I come in a month earlier, I probably would be here to talk about it.
Wow. Wow. And that speaks also to the risk of recurrence. There's a 39% higher chance of breast cancer recurring in Black women. And so, having battled the disease, it still remains present in our minds and in our thoughts and in our daily habits that this cancer could come back. And so, why don't you talk a little bit about triple negative breast cancer for us?
Sure. I had triple negative breast cancer, and it affects everybody it's about 15% of breast cancers, but it affects Black women at 2.3 times the rate, 2.3 times the rate of white women. And it's affecting our younger women in huge numbers. And it's the only breast cancer that does not have a drug to prevent recurrence. And so I'm sure you guys heard of maybe tamoxifen or Herceptin, you take something for 5 years and it helps you prevent it. We don't have a drug. And so, my drug is God and paddleboarding. But I think it's a horrible disease. When it comes back with a vengeance. It's extremely fatal and very difficult to treat. My doctor says I'm, a miracle, her miracle, because I had stage 3A triple negative. It came back a year later. I was told I was metastatic, and I did a lot of chemo and it went away, and we don't really know why. So I know I'm very blessed to be here. I'm very passionate about talking about breast health. But triple negative, that picture actually is my friend Amber. She died 3 days before her 29th birthday. And she was diagnosed, kind of dismissed by her doctor, and went into treatment, but it was just so aggressive. She couldn't fight it. She fought a hard fight, but I'm very blessed to even be here to talk about it, because a lot of us aren't. We have a lot of new things on the horizon, but it's still a nasty beast. Nasty beast.
It's true. What's that?
No, I said it's just a nasty beast,
It is. And I think, when we read things like this, triple negative breast cancer, it's really important for us to understand what that means. What are hormone receptors? And, too many times I'll come across a patient and do a second opinion, and I'll say, so what do you understand about what's going on? And they don't. And so you can't understand your treatment if you don't understand what type of disease you have. But essentially, for the people who are watching, triple negative breast cancer means that they do not have hormone receptors on their cancer cells. Hormone receptors are little places or stations for them to receive a signal that I'm going to stop sharing my screen here. But it basically allows the cancer cell to receive a signal that then triggers cell growth. So I tell, my patients here, I'm in Pennsylvania, that is sort of like toll booths on the PA Turnpike. If you have the toll booth, then you can pay the dollar and go through the toll. So the dollar enables you to go through the toll. Essentially, the hormone hits the receptor and it triggers new cells to grow. So that's the basis for how pills like tamoxifen work. We give you a pill that blocks your estrogen. If you're postmenopausal, you get an aromatase inhibitor. It blocks your estrogen so that you can trigger no new cell growth. And so women who don't have those receptors, they're in the easy pass lane. So, that's the easiest analogy. I can take away all your dollars, but you're
Right.
not using dollars. And so that medication is not effective. And that's why
Right.
those women need chemotherapy, because something has to treat the breast and then something has to treat the whole body. And whole body treatment is medicine, either
Right.
through a pill or through an IV or
Right.
through a port.
With the
And
report.
so black women get the more aggressive kind, and for which there's no pill. There's no miracle cure. There is no magic bullet. And so we wanted to shine a spotlight on this week in particular, because we need to listen to Black women and believe Black women, and we need to advocate for ourselves and for our sisters. And so we have a guest here who's going to join us now. It is a friend of mine. She is 29 years old. I wonder if our host and our administrator could add her to the conversation. Her name is Jasmine Witherspoon.
She's our blessing today. Hey, Jasmine.
There she is.
Hi.
Hey, there's Jazzy. So Jazzy's
Hi.
29 years old, and I met you at the inaugural celebration for Cancer Who. Do you remember
Yes.
that?
Yes, I do. Yes, I
Yeah.
do.
Our good friend Al Harris, who we're going to have on, he's going to talk about Cancer Who. It is a community center for the community, in particular for the Black community, to go and use as a resource. And we had a grand opening, and they asked me to give a few words, and I got a chance to meet you, and you and I just became fast friends.
Yes.
And I wonder if you could tell us your story. So give us some information about your diagnosis, how was it found, et cetera, and your treatment, and where you are now, if you're willing to share.
Yeah.
Sure, sure. I was diagnosed back in 2016, September 2016, with aggressive stage 3 triple positive breast cancer, hormone positive breast cancer. I did a double mastectomy, reconstructive surgery. That was about a 9 to 10 hour surgery. After I recovered from that, I started an intensive chemotherapy. Excuse me, I'm sorry, and I did radiation as well. And then my journey was just long, and it just progressed. And then in February of 2019, it reoccurred, and they told me that I was metastatic and that it was in my lungs, and it had switched from hormone receptor positive to triple negative, which blew my mind because I've never heard of cancer getting smart and switching to something different, and that's what it did.
Beast.
And then I started treatment for that, and my tumors went away in my lungs, and I thought I was okay. And then here comes this sneaky cancer again. Now I have brain tumors as well as tumors in my spine, as well as the fluid that surrounds my membrane that also surrounds your spine. I have cells in that fluid as well. So basically the tumors can just land anywhere on my brain, anywhere on my spine, and they can just do whatever they want to do because they're in my fluid. Um,
Jasmine, when did you get the last diagnosis?
So these two last diagnoses was October and November of 2019. So those are my two recent um, diagnoses. And then just recently, last month, I was told that I now have tumors in my liver. So my cancer is progressing. What my paperwork says is not what I look like in person, obviously. A lot of people think I should be on ventilators and I should be in the hospital and I should be laid up and I shouldn't be talking. And I know I'm a walking miracle. I have exceeded all expectations of what my doctors have said. I done been put on hospice twice. I done signed myself off because I was like, this isn't for me. I am going to continue to fight until the wheels fall off, which is what I do. I have two young children, a 7-year-old as well as a 3-year-old, a boy and a girl. So those are my those who I fight for every single day. I also have fluid that's building up on my lungs. So I have something called a Plurex catheter that's in my side that I get drained 3 days a week to relieve some of the fluid. My new symptoms are I'm now retaining fluid in my body. I have so much cancer in my body that, correct me if I'm wrong, Dr. Gary, the potassium in my, like the fluid don't know what to do, where to go, how to be. And because there's so much cancer in my body, it's just filling up in my feet, my ankles, my legs, everywhere. So I'm just retaining fluid, which is why it's hard for me to catch my breath. And I'm so bloated, and when I'm talking, I have to like breathe and take deep breaths and everything. So that's my new diagnosis, is the fluid. It's just building up, but I'm still moving around. I'm still walking around. I'm still up and moving if I can. If I can't, then I sit down. I definitely excuse me, I definitely listen to my body. I know that my bones are very fragile, so I take my time with everything that I do because of where the tumors are placed on my spine and my brain. I know that if I fall, I can break my bones and everything. So I definitely listen to my body for sure, and I don't overexert myself. It's been a little hard lately, these past couple of months, because I'm losing my independency, and this is the first time that the cancer has actually put me on my butt. And I can say that since 2016, battling this, I was always straightforward, straight head first, and I was whatever. I was knocking cancer out one cancer at a time. Whatever they said I had, okay, what treatment we're going to do for this? I done did brains radiation. I done did spine radiation. I done did breast radiation. I done did um, multiple chemos. I done did infusions. You name it. I done been on tamoxifen. You name it, I did it, and I tried it. If my doctor thought it was going to help me, we did it, and that's a big thing that I want to share with everybody, is that a lot of people are scared to jump out there and try what the doctor is offering, and with all of this all natural, things going on. And I will say, even though I did chemo and infusion, I still detox my body, because chemo is harsh. It's harsh on the body. I've had to shave my hair 3 times. The third time it was very emotional for me, because my hair had grew back very healthy. And I'm not saying that hair makes you, but mentally sometimes you just feel like, wow, I have to go through this all over again after we just did it before. But then once you get into that fight, it's like, okay, we knocking it out again. It's just hair. You cry, wipe your tears, you pick yourself up, and we say, okay, tomorrow's a new day. And I literally just take it one day at a time, 1 hour at a time. And like I said, I've exceeded all expectations of what the doctors say, and everybody tell me I'm a walking miracle. And I just keep positive mindset. But I'm not naive to the fact that my cancer is progressing. I'm not going to sit back and say, oh, I know that I can go from 0 to 1,000, or I can go from 1,000 to 0. And that's just how cancer works. One day you can be okay. One day you can't be okay. So once you get that in your mind, and once you become at peace with your diagnosis, or once you understand your diagnosis and understand what the cancer does to the body, and you take your time and you research and you realize, okay, this is that, then you can better have an understanding of how things will go. And then sometimes you don't have an understanding of how things will go, and you just ride in that roller coaster one day at a time, 1 hour at a time. So I just want to tell everybody, just, if you can, keep a positive mind. But if you have a bad day, that's okay too. It's okay to have bad days. It's okay to not be okay. It's okay to be okay, and you just weather the storm, whatever it brings to you. So, and a lot of people always say, oh, but you're always so positive, and you have like 4 different cancers, and but I've exceeded all expectations because of how I was so positive, and because of how I tackle it, and how I look at it. So,
Jazzy,
You're
tell me
fighting
about
like a girl. You're fighting like a girl. I love it.
absolutely.
Girl.
What do your kids understand? Tell me about the supports and what sorts of things are you able to do and offer them to help them work through this period?
well, the one thing that I like, the nursing agency that I'm signed on to, Penn Medicine, every Friday, the therapist FaceTime my daughter and my son, and they have a session for about 45 minutes to an hour, just to talk with them and see where their head is, and see, what they know and how they're feeling. And I really, really like this service, and I really appreciate the fact that they can get that. She's only had 2 sessions so far, but she really liked the therapist. She opened up to her. They even do coloring. She has like different things that she allows her to do, over the phone and everything. So I really appreciate that. I talk with them a lot. My daughter understands a lot more. My son was only 6 months when I first started my journey. So now that he's 3 years old and he's now that they're not in school, they're exposed to a lot more that they would never be exposed to, like my nurses and me taking my vitals and me being drained. So because of this virus, it kind of like made me have to explain a lot more than what I normally would have, because so they only came to Fox Chase when I rung the bell August of 2018. So for them, that was a happy moment. Like, mommy completed chemo, mommy finished chemo. That was a happy moment. Mommy rang the bell. So for them, Fox Chase and cancer was okay. Mommy's finished. But now that I'm progressing and now that I'm sick and I'm laying in the bed and I have nurses and I have around the clock care, now it's okay. It's mommy going to be okay. So and my daughter, she knows what cancer is, but she doesn't really know what cancer is. She loves the color pink. She loves the cancer symbol.
The
She
ribbon.
when I get blankets from the hospital, she loves to like sleep with them. This is a blanket. She loves to sleep with the blankets and everything. So whereas my son, he's just emotional. He's just very emotional. He's crying. Some days he want to hug me. Some days he don't want to hug me. Some days he want to be up under me. Some days he doesn't. And he's asking a lot of questions. And their one question is mommy going to be okay? And
Mm.
my doctor's actually yesterday, she's sending me 2 books to read to them to have that conversation. And one of the books, I think it was called something about how to talk to a child when the parent is sick, and then the other book was something else. Oh, that's my mom. So yeah, so my village is very strong, and I have a very great support system, and so we all talk to them. Like, I try to put it in layman's term as much as possible when they ask me questions, and I try to break it down and I try to get them to understand. But you never know what the child mind is thinking and wandering
Yeah.
and stuff like that. So yeah.
Mhm. Now, tell
Yeah.
me about any research or clinical trials. Have there been some barriers for you? Has anyone talked to you about different trials?
Um, Yes and no. So when I started progressing and I got the brain tumors and the spine tumors, I went to University of Penn to see another oncologist, just to get a second opinion, just a fresh set of eyes. I felt like things were just happening too fast. It was just everything was just going too fast, and she told me that they had different trials over at University of Penn, which is a bigger hospital, and it's more, they do more research than Fox Chase, which is a smaller hospital. So, but I haven't tried any trials or anything like that. My recent infusion was Herceptin and Perjeta, which is something that I was already on. Oh, so that was the other thing. So my tumors that were triple negative, they turned back to hormone receptor positive, which my doctors were
Really?
happy because you can treat hormone receptor positive better than you can treat triple negative. So that was mind blowing as well, because it's like,
Mm.
here it is. I went from hormone receptive positive, and then I did everything to prevent that. I even had a partial hysterectomy because I was scared that it was going to come back in my other organs that carry hormones. And a partial hysterectomy at 28, I got it the day before my birthday. It
Wow.
was crazy. That was like a whole big thing. And then here it is, it switched to negative, and now it's back to hormone receptor positive. So they offered me the infusion, which was Herceptin and Perjeta, which I only did 2 treatments so far. And then that's when I started building up all of this fluid. So I just stopped doing that treatment 3
Was
weeks
it
ago.
was it a hard decision to stop treatment?
No, they just told me that basically it wasn't working, so I just had to stop it anyway. Um, I wasn't going to do any more treatment. The other treatment they offered was to put a port in my brain and give me chemo directly to my brain, or to do radiation again. And the brain radiation and the spine radiation was by far the hardest treatment that I have ever taken. And I told my doctor I will never ever. That cage being on my face, the radiation, the smell of it being burnt. A lot of young people, like they say, I smell everything. You smell metal when you smell the fluids. And when I walk in the Fox Chase, I can just smell all the medicine. And I just wasn't, that's something I'm not doing. So I told them I'll just live my life every day because that was by far the hardest treatment that I've ever did. And I was not going down that road anymore. And I definitely wasn't putting a port in my brain for them to give me chemo directly to my brain. So just recently, last week is when they just told me that it was nothing else that they can do for me. My treatment isn't working. I have to stop my treatment, and they're putting me back on hospice because of the fluid buildup in my legs and everything. So, and now that is in my liver, I am the fluid in my stomach is retaining under my skin. So
You have a beautiful spirit. Thank you for
thank you,
your
Mhm.
story.
thank you.
Um, Jazzy, tell me about genetic testing. Did they offer
Yeah.
you some testing for like BRCA mutations and the others? And did you test positive for any of those things?
They did in the beginning back in 2017. They offered me. I got tested for everything because I had a daughter and a son and a mom, and I have two sisters, two maternal sisters, and my aunt. I have a maternal aunt, and my great grandmom and my grandma both had cancer.
Mm.
And a couple other maternal family members had cancer, but no, they basically told me we don't know where your cancer came from. I did not test positive for the BRCA, the Angelina Jolie one that they. I signed on extra genetic testing that they offer because I wanted to make sure that my children were okay and my sisters were okay and even my son. I was really scared because I was pregnant with him when I was telling my doctors at my checkups that I felt two lumps in my breast, and I'm going to repeat exactly what the doctor said to me. African American women are prone to fibroids, especially after having children. So I had already had my daughter and I was pregnant with my son, and this is what she told me. Now when I did my double mastectomy, yes, I had fibroids in my left breast and I had the two tumors in my right breast, but because I was pregnant and it was hormone receptor positive, the tumors grew very fast. And it wasn't until I was breastfeeding one day and all of this blood started shooting out of my right breast. And
Mm.
that's when the doctors finally listened to me and did the mammogram. But I kept telling her when I was pregnant, I was discharging fluid. I thought it was milk because when I was pregnant with my daughter, I produced a lot of milk. I was engorged. My daughter was born with a lot of medical disabilities at Children's Hospital. So all I did was pump until she was able to come home. And then I produced a lot of milk. So while I was pregnant with my son, I thought it was milk, but it was really what I learned was discharge. And then one day I was breastfeeding him and I kept telling the nutritionist, this hurts really bad. I know breastfeeding hurts, but this hurts really bad. And they weren't listening to me until the blood started coming out. And this was at my 6-week postpartum checkup. And
Wow.
that's
We
when they
hear that
finally
so much.
decided to do the mammogram.
Yeah.
And that's when they found the cancer. But they could have all along found it while I was pregnant,
We hear
but they
that
wasn't
so
listening to
much
me.
that because you're so young, they don't take you seriously until
I
you have
can't. I can't hear
serious.
you.
Oh, you can't hear me? No, because you're so young,
I
um,
can't hear you.
Ricky, turn your volume up. Jasmine, can you hear me?
I can't. I can't hear you.
You can't hear either of us?
No. It
no.
says waiting to go live.
Hmm.
Oh, maybe you're
I think that might be your internet
It says
connection.
waiting to go live.
mm,
I'm still streaming, so it
me
might be
too.
your internet connection.
I can't hear you.
Okay, we'll work on it.
We do have a couple of questions from our audience,
Hmm.
and one of them is how do you maintain your positive attitude? But I don't know if Jasmine can hear us to be able to answer that question because she is a joy, right? I mean,
You know what? I'm going to text her and just have her talk. We can still see you. We did have another question
right.
um, about male breast cancer. So male breast cancer is much less common. Um,
100%.
what's that?
1%, right? Of
hmm It
yeah.
is. It's really it's just under 1%, but that number is increasing, particularly for men in the military, potentially due to exposures, men who have the BRCA mutation. So here's the deal on the BRCA mutations is that, if a man has it, his lifetime risk of breast cancer can be up to 8%. So 8 cents out of the dollar, which doesn't sound like a whole lot, but when you compare to less than 1%, or if you took 1 penny out of a dollar, that's a lot less than 8 cents. And the issue is that it's up to 8%. And so that means that the majority of men who have a mutation, so if your mother had breast cancer at 35 and your grandmother had breast cancer at 40, you could potentially have a mutation. And if that were the case, then you might not express it. You might never get breast cancer. 92+% of men won't get breast cancer and they have no ovaries. So you won't get ovarian cancer either. And so you can pass that mutation to your daughters. And so anybody who's watching, if you have a family history of breast cancer with 3 or more relatives on one side of the family, or if someone young is diagnosed with breast cancer under the age of 50, you meet criteria to have a conversation with your doctor. And we'll talk about that in a different episode. But
Yeah, we
you
have
know,
we have a great episode about that with one of our breasties, Tallulah Anderson. She has BRCA in her family, and both of
mhm.
her carry the gene, and she and several of her siblings have had breast cancer. So we'll talk. We can do a story about that. It's great. I mean,
I
it's
want to see if we can get Jasmine to log back in because I wanted her to talk about her faith and answer that question. She said she's trying now, but meanwhile, we can absolutely take some more questions.
yeah. Yeah. Let's see.
Let's see. Other things let's see, can we ask a question? Chandra Pickett, yes, you can. You can absolutely ask a question. I think another important thing to talk about is really to talk about, the signs and symptoms of breast cancer. The number one sign of breast cancer is no sign at all. It's found
Right.
most commonly on screening. But if you feel a lump, your doctor should take that seriously. And if you find a doctor who does not take that seriously and order some
Get
imaging for
another
you,
doctor.
you need to find
Get
another
another.
doctor.
Get another doctor.
Absolutely.
Yeah.
Nipple discharge, if you are not nursing, is not normal. If
Right.
you, let's say it this way, spontaneous nipple discharge. If you squeeze and fluid comes out, that is absolutely normal. But if you wake up and your t-shirt's wet, that's not normal.
Right.
It's challenging, especially in pregnant women, because the hormones in pregnancy can exacerbate breast cancer. And so, there's bloody nipple discharge, any nipple discharge, nipples inverting and pulling in, things like that. Those are all signs and symptoms you want to be aware of.
Yeah.
Thickening of the skin as well.
Dr. Monique, we've got a
hmm
question from Rhonda, and she's saying, do you feel it's safe to have a mammogram during this whole COVID crisis? And we're hearing a lot about that.
hmm
Fear. Well, what do you think?
Gotcha. So, right now during COVID-19 across the country, most centers are not doing screening mammograms because it's the risk of contracting the virus outweighs the benefit of getting a screening mammogram at this time. So, for people who need their annual screening, we're asking them to reschedule to wait potentially a month. For people who have an issue, have a known cancer, who feel a lump, who need diagnosis, we are still doing diagnostic imaging. So people who have symptoms can get imaging, but for annual routine imaging, we're asking everyone to delay that right now because we don't want people to contract the virus coming in and out of hospitals and imaging centers for just their annual routine maintenance. So
But if
I think
you do have a lump or you feel something strange, you know your body. You know your body.
absolutely.
But if you feel like something's not right, you
Yep.
need to address it and call your doctor and work it out, and be screened if necessary. Yeah. Yeah.
Mhm.
Um,
Absolutely. Other questions. What should males look for in breast cancer?
yeah.
I have a number of men in my practice, and they too have felt a lump. So, I always say, it's not just check your breast, it's check your chest. You should also check your breasts and your chest. And if you feel a lump that wasn't there before, if it's painless, if it's painful, men shouldn't really have lumps. And so, that is probably one of the most common symptoms. Sometimes their nipples will also invert. So a nipple going back in is not a normal finding either. I just talked to a patient today who had some symptoms, and it turned out to be what we call gynecomastia. So, some extra breast tissue behind the nipples that was causing it. It wasn't a cancer at all, but I really applauded him for even going and getting his imaging and, seeing a breast surgeon, especially a female one. And he said, I have no problem with that. I don't want breast cancer.
Right.
So you should check your chest, check your mammaries, however you want to say them, because there are a lot of non-binary people and, gender fluid people out there, and it is not specific to gender. Everybody's got mammaries.
Right. Actually, our founder, Karen Jackson, she actually thinks we should call male breast cancer chest cancer.
I
Male
love it.
chest cancer, and just change the name of it so there's not a stigma and not the sort of thing about it's only for women, but it's chest cancer for men. So
Hmm.
we love
I
that.
love it.
We have a question from Ayana. How can Black women better advocate for themselves?
You take that one.
Oh, so you have to fight for yourself, and I'll give you my story. My doctor really gave me 2 years to live, and when I really probed her, she had only had two other patients that had stage 3A triple negative breast cancer. And so she was 38, she was young. And so I said, well, me, you, and God need to work this out because I have to work, put my kid through school, through college. And so she actually went with me to get a second opinion. And that's very unusual, but she wanted to learn about triple negative breast cancer. And so the two of us went and found a specialist so that she could learn. But I had to stand up and say, hold on, if you only had two cases and both of the women died, we need to fix this because I can't die right now. So we have to figure that out. So you have to stand up for yourself. And every step of the way, if you don't feel like you're getting the best information, the best care, there's more care out there. There's plenty of doctors to go to. And I think Dr. Monique, she's a blessing to so many women because she takes time, but a lot of doctors don't take the time. And if you don't feel like you're getting attention and you feel like something's going on in your body that's not right, and that, then you have to fight for yourself and get another doctor, go to another nurse practitioner, go to whoever to get the care that you need. It's really your responsibility because I think my doc spends 5 minutes with what's the average time a doctor spends with a patient, and they're so focused on whatever chemo thing they have to talk to you about today. They're not always listening to what you really have to say. And they don't even say, well, how do you feel? How do you feel, Ricky? How do you feel, Monique? And so you really have to sort of force that conversation and think about how you feel so that you can relay it to your doctor. The other thing is never go alone. If you can help it, never go to a doctor's appointment alone. And I had so much support when I was sick that I always had someone with me by my side to have the conversations, take notes. I had my daughters on the phone taking notes, and so, but you have to really have a support system. So, because you're overwhelmed when you're in these office visits, they're throwing so much information at you, and you're sick. You don't feel good. You're scared.
Mhm.
So you really need
I
that.
want to I want to jump in here too, Ricky. Let me just say that there are so many more of us, and one of the goals of this program is to connect our viewers and Black women, especially, to Black doctors, Black oncologists, Black surgeons, radiation oncologists, and more, because I think that there is a sense of comfort that comes from finding. I can't tell you the number of patients who, when they see my name and they say, okay, Dr. Gary, and they think I'm a man. And then they see me and they say, oh my gosh, I'm so glad. I'm so glad to see you. Now I feel like I can talk to you. I feel better. Exactly. And we're out here. So we'll definitely connect all of you to the doctors who are taking care of cancer, especially. But, as far as advocacy is concerned, I think that one of the things that you can do is, as you do your research, write down your questions so that you have them already. Because when you're in there and that doctor is going over things, a lot of times it just goes right over your head.
Go over your head. You don't
And
hear
you
it.
need to stop that doctor. I tell my patients, listen, nobody leaves until everybody understands what's going on.
Right.
And
There's so
so,
many big words and that
mhm,
that you can't have the vocabulary for it, and you need
true.
help.
Yeah,
You know,
it's true. Partner with the community organizations, because lots of times you'll find survivors who are willing to go with you, who are willing to answer questions, who are willing to share their stories and their network. We really do need kind of a green book of, who was your oncologist, what plastic surgeon did you see, and who spends time with the patients and help each other navigate. And so finding people to help you navigate from the community is really important because in more affluent settings, there are navigators who will help you navigate through every aspect. There's things that, services that can go to people's houses, like
right,
fresh organic produce, and you can get acupuncture and Reiki. Well, if you live, in the inner city and there's no acupuncture and there's no Reiki services near you, how are you going to get access to those things?
right. And
And
Sisters Network, we have a lot of resources. If you call us, go to our
mhm,
page, we post on Facebook every day, and we can try to help you get. I mean, Karen Jackson founded the organization
amazing
because she
organization.
employed in the Black community, and interesting. I went to a support group when I was sick, and Northside Hospital, Atlanta. I was the only Black patient in the room, and I was the only one with triple negative in the room. And I couldn't relate to anything that anyone was talking about. So having a sisterhood of Black women is just so important, so that you can have people, and I love my friends so much, but I love my breasties. I have a different relationship with my breasties because they've been through what I've been through, and I can call them and say, okay, this is what's going on, this is how I feel. Oh, or today I'm having a suck day, help me out, because they have a different understanding of what we're going through. And we have a network of amazing women all over the country in 20 chapters to help us. So there she is. She's
Can
back,
you
our
hear me?
Jasmine.
We can hear
Yay.
you. I,
Yes.
I, I want to let me just interject real quickly, Ricky, and say you're absolutely right. And Ayana brought up a great point. And she was on our first program, and she said she fired her oncologist and found a new one. I
Right.
think that you should not be afraid to get a second
Don't be
opinion.
afraid.
Any doctor who is offended by that is maybe not the doctor for you, because you always have the right to
Right.
get your questions answered. Use your
Right.
networks and your resources. Go to Sisters Inc. and find people who will partner. There are chat groups there, and they're a source of friendship and strength because you are not
Right.
battling this alone.
You're
You're
not
alone.
We had a
no one.
question about a fibroadenoma getting removed. If something is growing in your breast and getting larger, it probably should be removed. Even if it is likely benign, it at least needs to be biopsied. So to the person who asked that question, yes, anything larger than about 2.5 inches, number one, should be removed. But if you feel a lump and it's getting bigger, some doctor needs to do a biopsy of it. But Jazzy, we got a couple minutes left, and I want to give
Okay.
the floor to you. I want you to tell me about your faith. Tell me what you said
Yeah,
about
I want
your
to know why
bishop,
you're
and
such a miracle. Like you have how your spirit is so high.
tell us what's
Oh,
getting you through,
so
baby.
okay, so I got baptized in December, and once I got baptized, I started um talking to my bishop more and realizing that when you find your purpose in life and when
Hmm.
you find what God called you to do, and you're at peace with it, then you know that you're covered. And no matter what no doctor say, you know that God has the final say so. And I'm realizing that my journey of going through all of this cancer and trial and tribulation, and it's hard, and it's really hard, and I am tired. I'm sick and tired of being tired, but I have to realize that this may not be my fight. The fight that I'm fighting for my life may not be for me. It may be for my family. It may be for my children. It may be for me to show everyone that you can have all of these cancers and you can be battling this and you can be a walking miracle. People keep telling me I'm an evangelist or I'm their shero or I'm their hero or anything, and I'm realizing that this may not be my fight. And I know he don't put no more on someone than they can bear. And like I said, it's hard. It is hard. It is really hard to
The best.
carry this burden and to be that person for everyone, to be that person that everyone calls on, to be that person that everyone, asks questions about, or, I'm very assertive with my doctors and I'm very, to the point, and I've been running my care since day one. So I'm learning that, this may not be my fight. Two, I may be going through this for everyone around me. And three, I'm just trying to listen and find my purpose and see what it is God is calling me to do. And once I complete my mission and once I'm finished, God forbid, I hope not, he doesn't call me home. But if he calls me home, I'm okay with that. I've made peace with my illness. I'm not okay with my children being without me. And that's something that I'm praying on. And that's something that I'm working on. I'm going to make videos and write letters and stuff for them to have if I do pass on. But, at the end of the day, God has the final say so. And it's nothing we can do. And it's something my mom told me. You are my child because I birthed you, but you are his child. He loaned you to me. And
Wow.
I do not own you. You're his child. And when he's ready to come and get you, he will come and get you once you've completed what you're supposed to do. And not everybody in life can realize that. And not everybody in life can hold on to that. And like I said, I talk to my bishop a lot because this is a big responsibility. This is really hard, and it's not easy at all. But so and that's pretty much where my faith is with it. So, and like they say, through his stripes, we are healed. He died
Yeah.
on the cross for our sins. So, once I went under that water and came back up, I was declared healed. And that's what I have to believe. And if I don't believe it, then what am I doing?
Wow.
So,
Blessings to you.
You said something. I don't know. Some people who know my story know my mother died at 29 of ovarian cancer, and she left behind a 7-year-old me and my 10-year-old sister. And so, you just never know, like you said, how this can impact your children, your children's children, the entire future of your family and our community. But, this is something that from the minute I met you, I knew that you were and are magic. You are
thank
black
you.
magic personified, baby.
Thank you. Thank
And
you.
Absolutely. And
can
I'm
I
so glad you shared your story. Go ahead, Ricky.
I was gonna add one more thing. I remember in one of my darker days, I called one of my prayer warriors at 4 in the morning and said, "Okay, Vet, I don't know what to pray for." And she said, "Well, pray for healing, damn it." And I was scriptures, but I knew in my spirit it didn't feel right to pray for healing. It was right to pray for God's will to be done. And that's what I prayed for. And I think that's what healed me, that I prayed, okay, God, we're jumping off this cliff. You know what I need. You know what's going on. You have to put this kid through college. And you have to just relinquish your faith and give it to God and
Absolutely.
because He is in control. And
Absolutely.
not a doctor, not a nurse, not a drug. All things work together for good, right? But
Absolutely.
but you have to relinquish your faith, and I see you are such a blessing to do that. Thank you so
Thank
much.
you.
Thank you
Thank
so
you.
much.
I'm trying.
Oh, you are doing it. From the
We
minute I
got
I'm
met
prayer
trying.
warriors out here. Got a
you,
lot of
know,
prayer warriors out
Yesterday, I was like, "Can I pick your brain, please?" She was like, "Go ahead." And from that day, she's been available. She's been there. She kept her word from that day, and we celebrated our 1 year anniversary of Cancer Who. So it's been a year that I've known Dr. Gary, and she,
there.
like I said, she has kept her word this entire year. And any questions I've ever had, anything that I ever needed to ask her, she's answered and been there every step of the way. So I appreciate you for being
I love
available
you're
to
Give
not
her
my
a
me.
big hug.
you're not
Give her
my
a big
patron,
hug.
but you are my friend. You're my friend. You're
Yes.
my sister, and I will always be there for you. And I think your
Thank you.
message is so important for people to see. It is National Minority Cancer Awareness Week. And,
Yes.
it really, the whole month is National Minority Health Month.
Yeah.
But this particular week was dedicated to cancer. And, we really need to shine a light on this thing. So I am just I'm so grateful to blackdoctor.org for giving us a platform to even talk about
Yes.
these
Thank you,
things.
Gary.
We want to talk more about breast cancer and COVID because this is a challenging time right now for people to get their treatment and to stay connected and to get the same resources. And so we'll talk more about that. But we had to take a break. I'm gonna call you our praise break. We had to take a praise break and give thanks for you and for your story and just for your light. You're so
Yes.
beautiful, and
So,
Thank you.
so
I'm so
precious.
blessed to know you.
Thank you. Thank you. I told you we fighting this thing till the wheels fall off, and then when the rims
Got it.
is rolling, we still going down the hill.
All right.
I hear that. We're gonna get a nutritionist in to see you as well and talk about that fluid and get, your
Yes.
proteins and your liver. And there's a lot more that we could say about it. I think our time is probably winding up, but
Yeah.
making sure that we try to increase your protein is going to help
And
that.
that's what and I talked to my oncologist today. So I was thinking eat better, but fruits is water. So
Yeah,
I'm sitting over here trying to eat
and
fruit
sugar.
and I'm sugar and I'm putting more fluid on me, and she's like, "No, no, no. Protein."
Hmm.
So now I'm googling protein and trying to do that. So it's a
Yep.
balance, and you figure it out, and trial and error.
Yep,
Yeah,
So,
we'll talk
that's
more
for
about
help.
it and
That's
make
for
yeah.
sure
help.
that we
Yeah.
get a nutritionist to see you,
Yes.
and see if we can, try to right the ship a little bit so that we can resume some treatments if that's what you're interested in.
Yeah.
Um, but Ricky, any closing remarks? I know you always like to end with something, don't you?
No, I just, I like, fight like a girl is my motto. Fight like a
Absolutely.
and she is the perfect example of fighting like a girl. We got you.
Thank you.
You and
Thank you.
keep doing this every week. And, we hope to see you guys with us next week. What are we going to talk about next week, Doc?
Oh boy, I think next week we're going to invite medical oncologists and maybe a radiation oncologist and talk about all the different types of treatment that's available and what's happening during COVID, because we don't want Black women, especially, to think that they're not getting the standard of care. People's
Right.
surgeries are being delayed. People are not getting their radiation right now. Everything is kind of in disarray. So we're going to talk about what it should be so that you can understand where we are and what treatment is supposed to look like at this time. So we just encourage you guys to log back in if you can, for survivors, for metavivors, for previvors, for all our warriors
Warriors,
and their
thrivers.
and their family and their supporters as well. It's something for everybody here.
Right.
You
And you
can
can
find
follow.
us on social media. Ricky, why don't you give Sisters Network so that we want to keep
Yeah.
the conversation going. We want your questions and your comments. We want your testimonies. So why don't you tell them where to find us?
Sure, you can email us at infonet@sistersnetworkinc.org. You can find me on Twitter at Ricky Dove, RICKIDOVE, and reach out on Instagram or Twitter. And Monique is on Twitter as well. As
Instagram as well, Dr. Monique Gary on Instagram. You can always message me. You can log in and follow us, and we'll give you the scoop. So thank you
right.
again to
Thank you, Doctor.
blackdoctor.org. And Jazzy, I love you.
Yes. Love you
Love you
guys
guys.
Praying
too.
for
Love
you.
you guys.
And I'm excited about the book. Somebody said you got to write a book. One of the comments.
Well, I
Good.
am. I am. So
Good.
like I said, my daughter was born with a lot of medical disabilities. So my book, and then I was pregnant with my son when I got diagnosed. So because of them, I survived, and I'm gonna make sure that I get that on the shelves.
That's your legacy.
Definitely.
That's your legacy.
That
There you
is
go.
definitely, most definitely my legacy. And I also started a LLC called Survivor Circle, where I would host it twice a month at the Cancer Who Care Center, and we just sit around, laugh, talk, cry, scream, pray, holler, whatever you want to do. But it's called Survivor Circle LLC. So definitely. So, but because of them, I survived. I'm gonna get my book out there. I promise.
Great.
Absolutely. I'll
All
do
right.
whatever
Promise
I
you.
can to
Help you.
help
Let
you.
us know. Yeah, let us
I
know.
will. I
All
will. I
right. Everyone,
will.
take
Well, thank you
care.
all for logging into the Doctor Zen. We
Yes.
hope it's relatable, it's reliable, we hope it's real, and we'll see you next week. Thank you
Yeah.
all so
Stay
much.
safe,
God
safe
Yes.
bless.
and
Bye
healthy.
bye.
Bye.